Right. Good afternoon, and welcome to our second Hawkeye Parent and Family webinar of the 2018-2019 academic year. My name is Lisa Kelly, and I work in the Office of Academic Support and Retention, and I'll be the moderator for today's webinar. If you're unfamiliar with our webinars, they're hosted on the first Friday of each month from noon to 1 p.m. We hope that each one provides you with up-to-date information that may apply to your students' transition to the University of Iowa. We know that parent and family members play a vital role in student success, and we hope that these webinars provide a platform for us to provide you with resources that help you support your student in their success. If you can't attend every live webinar, we do record and post them later on both our website and on YouTube. For more information, future topics, or to sign up for webinars, please visit parents.uiowa.edu and click on the Resources tab. Each webinar has a short presentation and then a question and answer portion, where you can get your questions answered by our campus experts. Today's webinar is Handling Homesickness, Strategies for Success. We're very lucky to have a wonderful campus partner with us today. Dr. Kathleen Staley is a staff psychologist at the University Counseling Services. Dr. Staley will share information that will help you and your student understand how to deal with homesickness and resources available to help students get through this. I'll turn it over to Dr. Staley.
Good afternoon. I'm very happy to be with you today, and we're going to talk a little bit about homesickness and what we might be able to do. We have some learning objectives today, and they are to understand the etiology and the concept of homesickness, to understand the effects that homesickness can have on student success, and to learn ways to empower and to support a student who is experiencing homesickness. I wanted to look a little bit at the history of homesickness, so just for kind of interest's sake, the etiology of homesickness. Nostalgia, a longing for a lost home, was the original term for homesickness. It was conceived at the University of Basel in Switzerland by scholar Johann Hofer in his dissertation that was written in 1688. The word is derived from the Greek word algos, which means pain, grief, or distress, and nostos, meaning homecoming. The word was originally used specifically to reference the Swiss and was often considered to be fatal. By the 1830s, it was used to describe the experience of sailors and convicts and African slaves. In the 1850s, many gold miners experienced great levels of homesickness. 19th century governments crafted policies to deal with homesickness. In Canada, the Canadian Army banned bagpipe playing because it made the Scottish recruits lonely and sad. In the United States, the song Home Sweet Home was banned from being played in the Union Army camps during the American Civil War. In the 1950s, we adopted the philosophy that in order to survive in a capitalist society, we needed to help our children be able to leave home and become more interchangeable and mobile. So some current definitions of homesickness. It is the distress or impairment caused by an actual or an anticipated separation from home. Some of the signs and symptoms may include a student calling home more frequently or asking to visit home more than you had expected. A student having preoccupying thoughts of home and attached objects. A student's expression of dissatisfaction with everything and everyone. There could be some depressive symptoms, which could be indicative of excessive consumption of alcohol or food, or even loss of appetite, or excessive watching of television, working with the internet, or video game use. Anxiety or an agitated depression can also happen, or very withdrawn behavior. We can look at some of the causes of homesickness, the transition from home to the university, the challenge that students face of independently managing their own lives. An adjustment can be further complicated by cultural differences, and these and other challenges often instill self-doubt and force an uncomfortable recalibration of students' academic and social self-concepts. The impact that homesickness can have on your students' success. Adjusting to the demands of college, academically, in the classroom, and socially, out of the classroom. There's a lot of adjustment that needs to take place. Making friends and feeling like a student fits in with this new environment. Struggle with staying on campus on weekends, resulting in decreased opportunities to connect with other students at the university. It's important to stay on campus, to get involved in campus life, and that can really be harmed if people go home too much. Can also impact procrastination, disorganization, and perfectionism. And self-doubt about a student's capacity to succeed can happen. There are some ways we can help your student overcome homesickness. We want to help them normalize their feelings. It's okay to feel homesick. You're missing a place that was safe and secure and that you felt very familiar with, and that many students do experience homesickness from a little bit to sometimes it can be quite extensive. It's important to help a student understand that adjustment can be an opportunity for growth. We can learn new things and grow in our own self-concept and our own ability to manage life issues. Bringing some pieces of home to their new environment can be very helpful. And seeking familiarity. Where on the campus or in the residence hall might there be some places that seem kind of familiar to them? Or creating familiarity, finding a place that you go to or visit or frequent that becomes kind of familiar to you can help with homesickness because it feels like a safe place that, again, begins to look familiar. Building a support network is very important. Meeting some new people and finding people that can be supportive of you. And that can be anyone from friends to your roommate, to the people on your floor, to your professors, to the staff in the residence halls. I've had professors say, I have office hours, and some professors say many students come to those office hours. But I had one professor tell me, gee, I've got these hours set aside and no students come in. I'm really looking forward to seeing them. And I think that really helps when you're learning new things to connect with your professors. Maintaining physical and mental health. The University of Iowa has wonderful places to work on your physical health. The recreation center, and there are various swimming pools, and there's ways to play intramural sports, but many places to work out, even in the residence halls. And I think that's a wonderful thing for physical health and obviously mental health. And I know the RAs in the residence halls do a wonderful job of helping students who feel a little homesick to feel better. And then again, the University Counseling Service can be of help, and we'll talk more about that later. Being open to making new friends. I think it's important, and sometimes you'll meet people that are a little different from you. If you come from a place where everyone is a little more similar, that can be exciting and a new learning opportunity. Allowing and schedule time to call, text, or even visit with family and friends from home. That is important, to come up with a time to talk and communicate with people at home. When my daughter went off to college, she went kind of far away, and I can remember leaving her there, and the drive home was a little challenging for me. But what I realized was when I got home, we had not made a plan who would call whom first. And this was a time ago before texting was particularly in fashion. And I was kind of worried. I thought, oh dear, should I call her? What should we do? I was feeling a little desperate about it, and all of a sudden the phone rang, and my daughter called me, which I was so happy that we established that. But I recommend to people, talk about that before and figure out a time or a place. Recognizing that too much contact with family of origin can have a negative impact. It's not good to spend so much time talking with or visiting home that it takes away from integrating into the campus community. Encourage your student to explore the campus. Many beautiful and interesting places. I like to talk to students about all the libraries on campus. I believe there are 8 now. There used to be 11, but due to the flood, I know there are fewer. But I tell them, make sure you go to the art building. I believe it's called the Art Building West, and it has a most beautiful library that overlooks a pond and some rock work. So
That is one of my favorite buildings on campus.
isn't it beautiful?
It's very peaceful inside.
It is, and it's peaceful outside too.
Mm-hmm.
It's beautiful. So explore the campus. And if homesickness is really interfering with academics and daily functioning, please encourage them to seek services at the University Counseling Service. At the University Counseling Service, we provide a number of services. We do a consultation, so you can meet with a therapist one time just to consult and get some ideas about things. We have individual counseling. We use a brief therapy model, and so we do 6, 8, 7, 8, 9 sessions, but we have a very strong group therapy program. We have over 20 groups. They will all be full, and you can work in a therapy group as long as you like. I've had students in my group, often for a year, sometimes 2 or 3 years, to work through various issues. We do, and we have a case manager, a wonderful woman who knows all, and she literally knows all of the over 150 private therapists in town, and we can certainly refer when needed. Our services are free and confidential for all registered students. Last year, we served over 2,000 students for a wide range of mental health concerns. And this can be from problems that students are having to students who come in and say, I just want to grow a little more. I want to learn more about myself. I want to, think about my identity and how I want to be in my career and things like that. So it's everything from difficulties to self-growth. And we have a wonderful staff that consists of a doctoral level psychologists, and then we also have social workers, licensed social workers, and a number of doctoral level trainees. We have 3 interns that are finishing the PhD in counseling psychology, and they work with us full time for a year to finish that PhD. And then we have this semester we have 10 doctoral level trainees, and these are doctoral students working on the PhD in counseling psychology. We have worked to provide as diverse a staff as possible, and we do have staff that provide therapy in several languages, Mandarin and in Spanish. We are located on 2 sides of the river now. We are at West Lawn, which is a building immediately adjacent to the College of Nursing. It's the same building that Student Health is in. It's on Newton Road on the west side of the building, and you can see on west side of the river, and you can see a little bit on the map there. And this year we have started another part of the counseling service on the east side of the river, and that is located in the University Capitol Center on the ground floor, and we're very happy to have 2 locations. We also have some embedded therapists. We have 2 of our psychologists who have their offices in Catlett Residence Hall, and so students living in the residence halls can access therapy right there in Catlett Hall. The UCS is open Monday to Friday from 8 a.m. to 5 p.m. Our phone number is area code 319 and then 335-7294, or you can email us if you wish at counseling.studentlife.uiowa.edu. So, and there's a little picture of our staff, some of our staff, and it's a joyful staff and a very competent, well-trained staff. So we're there to serve your needs for your students at the University of Iowa.
All right. Thank you so much, Dr. Staley, for all that great information on resources to help with homesickness. We'll now move into the question and answer portion of our webinar. Please remember that we have lots of people attending the webinar, and our presenter is not able to answer specific questions about your student's experience, but she can provide information that might be helpful in guiding your student. If you have a question, type it into the question box on the side. We'll then read the question out loud so participants can hear, and then we'll answer the question. If we're unable to get to your question during the webinar, we'll follow up with you via email to answer the question. We'll just pause for just a second to see if we have any questions. All right. First question. How do I know if normal homesickness is turning into depression? My son was home for Labor Day and was really withdrawn, and I'm kind of worried about him.
Well, that's a good question because oftentimes when a student comes home, they're happy to be home. And so to me, that would be a key. If they're not happy to be home that weekend, I think I'd want to pay a little more attention. Oftentimes it's when they get ready to leave home again, to return, or on that ride back that you'll see more of that sadness. But if they're sad kind of the whole time they're home, I would want to have an assessment of that done because that could be more of a depression. Or if homesickness lasts too long, if they're really not making some progress with that within a few weeks, feeling a little bit better and getting to make some new friends and being involved in the campus community, again, I would want to do some assessment and do encourage them to talk with the therapist in Catlett Hall or to come over to either the east or west side and talk with one of us at the counseling service.
Okay. If a student wants to make an appointment with UCS, is there like a wait time or can they get in right away? What is the typical, how long do they have to wait when they're trying to make an appointment?
Again, a good question because we do get extremely busy and they have to have an initial assessment. So that means they have to see someone to figure out what's going on and what's the best service. That sometimes to get that first appointment may take a week or two, but our director has worked very hard to be very responsive to students. And there are two new things that we do. We have what's called same-day appointments. And these appointments are accessed, really you have to call to get them, but literally at 8 a.m. Often by 8:05 they're gone. But there are 4 in the afternoon, at least 4, that we keep for same day. And so someone can come in that way. Another thing that we've added, they're called quick access appointments. And they are 30-minute appointments rather than the standard 1 hour. And we have a number of those every afternoon, starting usually at 2 o'clock, that a student can call and come in and get quick access. And those are kept for each day. And so there are ways to get in quickly. And sometimes you might have to wait a little bit for that full assessment. But those are the ways you can access us.
Okay. You mentioned that the embedded therapists were just in Catlett. Is that just for Catlett students, or could any Res Hall student use that?
Any Residence Hall student can work with the therapists in Catlett Hall. So any Residence Hall student.
Okay. Can students choose when they meet with UCS, choose a therapist to talk to, or is it just the next person up, or how do they kind of match therapist with student?
Excellent question. Yes, you do have input. When you do that initial assessment where we ask lots of questions and we figure out, is brief therapy the best for you? Would group therapy be the best? We also have some 3-week clinical workshops, and they meet for 3 weeks. One is called the Anxiety Toolbox, so it deals with anxiety. The other one is called Getting Unstuck, and it has to do with depressive symptoms. And so in that consultation, we could assess that would really be the best treatment of choice. After we do a whole assessment about who you want to work with, or what you might want to do, we do ask the question, do you have a preference for the kind of counselor you'd like to work with? Oftentimes a student will say no, they have no preference, but sometimes they say, I'd rather work with a man, or I'd rather work with a woman, or I'd rather work with someone younger or someone older, or they can say, I've heard about, let's pick one, Dr. Ethington. She's wonderful. Could I work with her? You can make that request. Now, at a busy time of the semester, if she is full with her clinical load, there might be a little bit of a wait, but you can certainly make that request.
Are there any groups that are particularly for homesick students, like group sessions, or are there any groups that are particularly for homesickness?
No, they're really not. We have general therapy groups where that could certainly be addressed. And then we have some specific groups. We have a women's therapy group. We have several men's therapy groups, and they get full. Dr. Scott Liu is an excellent men's therapy group leader, and they get quite full. And then we have some eating issues groups. But I think the general therapy groups would be an excellent way to address homesickness, because they would have a group of 6 or 7 other students with a trained therapist there to deal with the wide variety of issues and concerns, but that's certainly a very legitimate concern to be dealt with.
Do most first-year students get homesick at some point?
I think so, and I think it ranges from a little bit to, over the years, I have worked with students that are severely homesick, and parents come down and actually stay in a hotel for a little while. That's very unusual, but that can happen. But I think I think that transition from a high school student living at home, which is typical, coming to the university, away from home, possibly for the first time, to manage things on his or her own, I think it's a very challenging life stage. And I think almost every student, at least the majority, have some feelings of, oh my goodness, this is a daunting task. And so we're very happy to help. By the way, the residence hall staff and the RAs, the resident assistants, I think do an excellent job of helping with homesickness.
Can I ask a quick question? The students that go home maybe on their first or second chance, what if they turn around and say, I don't want to go back? Because they're so homesick. They give up already. They don't want to go back. What should the parent do?
Well, that can happen, and it has happened. I think being as supportive as possible to encourage your student to talk through some of the ideas that we gave today on taking some things with you, giving it a try. How can you explore the campus? Who is your RA in the residence hall? What's your roommate like? I think really talking through how it is a big step, but we're your parents, we're very supportive, but we want to encourage this step in independence. So I would be encouraging.
I have kind of just a word of advice for parents too.
Yes.
A lot of times when I'm talking to students, they will, or if a parent calls our office because they're worried about their student, the student will have complained, or talked about being homesick or being overwhelmed or getting a bad grade or something to the parents, and the parents then are worried about the student for good reason. And they call, and then we bring the student in, and a lot of times the student, but a few days have passed, the student is now over that issue and is feeling fine, but they've never bothered to tell mom and dad that they're feeling okay. So sometimes, it's, obviously talking to them and working through, but then a few days later checking back in, and you might talk to a very different kid. Sometimes I always tell students, don't forget to tell your parents that things are okay now, because they don't, if you don't tell them that, they're not going to know. So check in a few days later and maybe see how things are changing before making really drastic decisions.
That's a very good point, because these are young people, and they're young and they're healthy, and they do things rapidly and quickly, as we know. And feelings can change, thoughts can change, and times can change, and situations can change, and that can be rapid. So it's a very excellent point. Good communication with your student is important.
Mm-hmm. All right, I think that's all the questions we have for today. So thank you again, Dr. Staley, for joining us. Just a reminder that all webinars will be posted online at uc.uiowa.edu/family-resources. That's a lot, but you can find them on the Parent and Family website as well. If we were unable to get to your questions during the webinar, we'll follow up with you via email if you have questions, and you can send those questions to uc-retention@uiowa.edu for a response from a University of Iowa staff member. Please join us for next month's webinar, Paying for Next Year, the Financial Aid Process. This will be on Friday, October 5th, 2018, from noon to 1 p.m. Thank you so much for joining us today on Iowa Go Hawks.